Zimbabwe has made the commitment to help reduce cervical cancer cases to save lives. This comes at a time when the country is set to benefit from a $600 million funding from the World Health Organization targeting developing countries that are heavily burdened by cervical cancer. We give you more.
Cervical cancer is one of the cancers that can be prevented or cured if detected early. It is never a death sentence. But the funding gap in the country has left many women at risk. The World Health Organization team from Geneva that is visiting the country for a cervical cancer elimination initiative changes the situation.
In fact, of the 20 top countries with the highest burden of cervical cancer globally, 18 of these countries are in Africa, including Zimbabwe.
It is hoped that the stakeholders' engagement, which also included the Ministry of Health and the WHO, will unlock adequate funding to help remove the country from that list.
What WHO is doing, we've developed, there are vaccines that are cost-effective. It's called the HPV vaccine. Giving girls the HPV vaccine, girls between 9 and 15 years old, giving them one shot of HPV vaccine will protect them from getting cervical cancer later on in life.
In a society with different beliefs, pushing for screening, for starters, will be crucial to reduce the number of cases.
Most women would not, having an internal exam can be a disincentive to most women. So the HPV DNA also has a component of self-test. So the woman can self-test, self-collect, self-sample collection, can collect the sample herself. There are many methods of making sure that these samples are transported to the health facility and it's tested.
The idea will be to reduce the numbers that go for internal tests. Only those that are positive then have to go for treatment. The Health Ministry says it is ready to roll out that program.
Yesterday we visited only 2 centers which can do DNA testing, that is Parinyatwa and Chinoi Hospital. We are rolling out, we would like to roll out a comprehensive program for elimination of cervical cancer. And part of the program would involve the testing.
Health Minister Dr. Douglas Mombeshora added that DNA testing will be a better method, even though they are currently using other methods. The ministry admits it still lacks adequate resources. As things stand, DNA tests cannot be done throughout the country.
The other issue that will affect us also is availability of personnel, trained personnel to be able to interpret those results. So I cannot say we are rolling out that particular type of test, which is the DNA testing, as a test on its own.
The ministry says focus will be on trying to get more resources to address the issue. And that is where the WHO also comes in. More than any other time, this country needs to protect its women.
Konapo Konapo, Ipapo Ipapo pa ZTN Prime, DSTV channel 294, the place to be.